Spring has sprung for sure. And we are all kind of feeling the effects of the beautiful weather, but also, allergies and all the things that are floating around with spring. We are here to talk about all the things that you need to know health related as it comes to this new season. Hi, my name is Megan Clanahan. I am the co-owner of Houston Moms. Today, I have Dr. Thomas with us from Next Level Urgent Care. Hey, Dr. Thomas.
Hi, thanks so much for having me.
It's so good to see you again. We talked a handful of months ago and it was cooler. We're getting cooler weather. But now we are warming up. So can you remind people your specific role at Next Level Urgent Care?
Sure, I am one of the regional VPs, vice presidents at Next Level Urgent Care, over 15 clinics in the Katy area, North area, and kind of central Houston area.
Perfect. And so if you've watched for any amount of time, you know that Next Level Urgent Care is our preferred provider for your urgent care needs. I have been going for years and years and years, and that is just the truth. And my kids go there. And so I feel like I can't keep up with the number of clinics that you guys have because you are expanding so much. So can you share with us how many clinics I'll have in Houston now? And then I know there's been even more expansion to our west. I had to think about directions real quick to our west in San Antonio and Austin.
Yeah, absolutely. So actually, when I started here about 5 years ago, we had 16 clinics, and now we've expanded to about 42. So there are 28 in the greater Houston area, two in Nederland and Beaumont, eight in San Antonio, and I believe seven in Austin now. So we are expanding rapidly.
It's amazing. And I think what's so great is as we talk to moms and parents on here is that truly, if you have an urgent care need, there is most likely a next level urgent care in your
Close
general
by.
community. I know one thing that I love so much as a mom and appreciate from a convenience standpoint and then just like a germ standpoint is your get in line online. So you can do that either via the app or you can do it via your desktop. But it allows you to get in line, get your spot, and then what happens after that?
So actually, yeah, it'll tell you exactly where you are in line, if you're third in line or fourth in line. And you can actually look at all the clinics that are close by and see which one has the shortest line so you can get in faster. And then they will text you when your room is ready and you have about 15 minutes to get there. And once you get there, you'll go right back to your room and you don't have to wait in the waiting room with a lot of sick people. So I think that's great.
It is my favorite thing to get that message. I live within about 6 minutes of one here, and I get the message like your room's ready. I'm like, get in the car. We're we are going, and we get pulled back immediately. It's the best thing. So make sure that y'all update your app, grab the app if you don't already have it. So you can take full advantage of that. You can also schedule appointments on there too. So that works better for your schedule. I love it. So we're going into springtime. What are some illnesses that we need to be aware of? I'm on like a handful of mom groups online and people will be like, what's in the air right now? Or what's my kid has had 104 fever for 3 days, but is negative for everything. Like, so what's happening in the world of illness right now?
So it's funny because I'm not from Texas originally, and so I never knew what allergies were until I moved here. But allergies are real, and it's really hard to differentiate between allergies and COVID and flu because sometimes those symptoms can present so similarly. So definitely in the springtime, we're looking at allergies. Flu is still present, unfortunately. And then we still have some cases of COVID that are popping up, along with asthma that can be exacerbated by the allergies, just
Mm.
general virus, which is not necessarily COVID or flu, but may act the same way, as well as gastroenteritis. We know our kids have those kind of things all the time. So those things are year round, but in the spring, sometimes those can be a little bit more present.
So at the clinic, so we go in, we have a fever, we're presenting. What are some things that y'all do at Next Level Urgent Care to find out the answers?
So one of the things I love the most about Next Level is that we really like to streamline everything. So it won't be that somebody comes back and tells you, "Oh, you need this test," and then comes back again. We want to make your visit as efficient as possible. So
Mhm.
our all have standing orders and they know the specific situations to test. So if you come in with a fever, they know that they need to test you for COVID or flu or strep, depending on what your symptoms are. And then they will tell the provider those results, take your vitals, they'll take your whole history. They'll put all that in the chart. The provider will read it. And then by the time they come to see you, they already kind of know everything about you, you know, it moves pretty quickly. So it'll be efficient and then hopefully all your medications will be sent and everything will go through as efficiently as possible. Cause I think busy moms always want everything to go as efficiently as possible.
Yeah, we don't have time to be sick, number one. And we don't really have time to like wait in the waiting room. So I do appreciate the expediency. You'll also have the combo flu and COVID test. So you only need that one
So
swipe, right?
actually, we moved to separate tests now, but
Okay.
know now that there's different indications for different ones, you know. So if there's only an indication for flu, we would only need to do that now. So
Oh, gotcha. Okay. So things have changed. Well, that means I haven't been sick in a little while. So that is good.
great.
Um, Okay, so we know if we have illness, we can go to next level urgent care, but something else that is also cropping up is our kids are getting back into sports. They're going outside, they are playing soccer. I think flag football is starting again, lacrosse, all the spring sports. What are y'all seeing in the way of sports injuries in the spring?
So of course, fractures are year round. That's like as people get out more, there'll be more and more fractures. And it's interesting because I think a lot of people think you have to go to the emergency room for a fracture, but that's exactly what we exist for. So we can tell you if you have to go to the emergency room, but 99% of the time, if it's a simple fracture, we can treat it. You know, so we can when you come in, if you're in pain, the tech can start the x-ray on you so the provider can look at that x-ray even before coming in the room and examine you and decide what the best course of treatment is for you. So that process is actually pretty efficient too.
That's great. Do y'all cast as well, or is it just X-ray?
We do splinting, and then typically when you're, for example, if you fracture your leg, you'd put a splint on because it's so swollen, so you want to give it that room for the swelling to go down, and you'd come back in about a week and then we can put a cast on and we can continue to follow you throughout the course of your injury until you, and we take casts off too, so you wouldn't even need to see an orthopedic surgeon if it didn't require surgery.
Oh, that's so good. And I think that's so important. Because I think as a parent, if your kid gets hurt, you're so panicked. Like, what do you do? And you immediately think it's my baby. I have to, run to the nearest ER. And I think it's good to be calm in those moments and be like, okay, how can we make this? Because we know that's Dr. Breeze, the CEO of Next Level. Um, how do we make this as fiscally responsible? Like, not the
Okay?
right word, fiscally responsible as it can be. We're not going to be charged thousands of dollars from an emergency room, right?
And we know, this next level is physician owned, physician run. So we know that the quality is going to be excellent because there's physician oversight for everything.
No. So we have the sports injuries, and then I was just telling you this story right before we hopped on, but we were also going to talk about, I mean, everything is coming out now, all the allergens, whatever, but also the bugs, and the spiders and all of this. And I got like a weirdo bite this morning, just sitting outside on my patio. Um,
Mhm.
it's fine now. I didn't need to come see you. So that part was good. We didn't
Yeah.
have to do this conversation in person. Um, but what kind of bug bites and things are you seeing as spring kind of springs up?
If I had $1 for every person that came in and said they had a spider bite, I would be a very rich woman. So it's terrifying because you never know what bit you, and most of the time it's not witnessed. A lot of people come in and think that they automatically need antibiotics for a spider bite or a bug bite. When a child has a bug bite, typically they'll have a really astronomical reaction. It'll look really red and really angry, but a lot of times just with supportive care, it'll go down. But also sometimes they'll itch it. And so with itching it, there'll be breaks in the skin that can create infection. So your provider at Next Level Urgent Care can definitely assess and see if it is infected and if it needs an antibiotic or if it just needs supportive care. But I think it's always great to come in and get it checked out just to see what you need.
Yeah. So I know in the past, as I've been bitten by a spider that I didn't see, it was a sniper spider, um, that I circled the bite.
Yeah.
Like where it happened to see like if it kept growing. Cause I think a lot of times kind of what you mentioned, like we get a little hyper. We're like, I got bit
Yeah.
by that, but you can't prove that it's grown. And so probably it wouldn't be a bad idea to go ahead and circle that.
Yeah.
Um,
That for you in the clinic too. We have body markers to do that. And usually I'll just give that to the patient as well because we don't use it on multiple patients. And so you can kind of measure that and see. And usually I'll tell patients if it grows outside this very quickly within the next day or so, either come back and see us or, these are the indications to go to the emergency room if it's spreading really quickly.
okay, a body marker. Is it like an actual marker or is
It's,
it like a tracker thing?
yeah,
Oh, I mean, I was just using a Sharpie, but that's
pretty same. It's just a fancy word for that.
I love it. I didn't know they all had that. I learned something new every single time. Um, well, again, this very quick video just to share a little bit about what is happening. It's springtime in Houston as it relates to your health. Dr. Thomas, thank you so much for joining us.
Of course. Thank you for having us and come on and see us anytime at Next Level. We're happy to have you.
And I truly can say that that is the truth. I have had the best care and the best providers at Next Level. And I highly recommend them. They are in, we said 26 locations, in and around the Houston area. They're open 7 days a week, 9 a.m. to 9 p.m.
Mhm.
You can get in line, online, highly recommend. Um, we don't obviously want anybody to be unhealthy, but it is really good to know that you have
Mhm.
a place to go if something does happen to anyone in your household. So thank you again, Dr. Thomas. And until next time, we will see you with another important health video from Next Level Urgent Care. Take care.
Thank you. Bye.